It is National Eating Disorder Awareness Week. It's a time to shine a spotlight on something that affects all different types of people from all backgrounds. According to the Department of Health and Human Services, nearly 30 million people are affected by an eating disorder. That's 9% of the population. And sadly, about 10,000 people die each year due to complications from it. 15% of women will suffer from an eating disorder by their 40s. But this impacts all sorts of groups. LGBTQ youth are 3 times more likely. Military members are affected too. 13% are men, nearly 22% are women. We spoke to the director of Quinnipiac University's Health Science program about this. She says this is a serious mental health issue.
We all have to eat, right? So when we're trained, right, so from very young, that you to make sure that you eat and you be careful what you eat, right? Diet and exercise is a perfectly normal thing, and for health concerns. So we believe that since we were very little. The difference becomes when, again, the mental health component takes over.
That's Cotilde Dudley Smith. She says an obsession and fixation with body image is what sets an eating disorder apart from regular diet and exercise. Signs to watch for include social withdrawal, fatigue, and obsessing over portions.
Using excessive condiments or artificial sweeteners to excess, that can be an implication. Mood swings, they can have GI issues, thinning hair, dizziness, sleep issues, and unfortunately, it can lead to more major issues, like in women, their menstrual cycles can stop. They can have cardiovascular issues.
Now, Dudley Smith says noticing those signs early on is key because the sooner someone gets treatment, the better. Eating disorders have actually been around in our society for a long time.
Back actually in 700 BC, there were eating disorders. No one knew what it was, but they would have these banquets and they would eat and eat and eat, and then they would purge or vomit so they can go back and can finish the banquet. So way back when. Now, they've been around that long, but it wasn't until the 1970s that we really started to recognize anorexia and bulimia, and 1990s became more of an understanding on binge eating.
Now, Dudley Smith says awareness really reached a peak when famous singer died from an eating disorder in 1983.
When Karen Carpenter, who is a singing member of the Carpenters, who actually was from New Haven, Connecticut, she passed from anorexia. And it was the first time people were thinking, wow, you can really die from this.
And being more aware helps people who are constantly being flooded by unrealistic images on social media and on television.
I actually went to a conference that talked about how, in magazines and whatnot, that's what's changed, that they don't really look like that. But it's, it's the selling point. So, but a lot of people, we filter that and we understand, okay, that's what it is. But when you have this vulnerability and you start to think, I'm not good enough, maybe you've been told you're not good enough, there's a bullying component that goes in there, that's when it flips the switch.
She says starting a conversation with someone who you may think may have an eating disorder is difficult. Making sure, one, they're in a safe place and that you don't use judgmental language. Dudley Smith says it's important not to define someone by their eating disorder. And we can all help reduce the stigma by increasing our empathy and by educating others.